Hello, everyone, and welcome. Thank you for joining us today. I'm just going to give it a few minutes for everyone to start joining, and we'll get started shortly. Hi, everyone. Welcome. Welcome, everyone. Thank you for joining us today for this Care for Caregivers webinar. My name is Kawal Mahmood. I'm supporting the Care for Caregivers program on behalf of SafeCare BC. If you are having any technical issues or have any questions, anything, please feel free to email me, send me a Q&A question, and I'll try my best to help you. This session will be recorded and will be made available for viewing after the webinar is done. On today's webinar, we'll go over practical de-escalation strategies when dealing with unsafe psychological behaviors as healthcare professionals. So this free webinar is brought to you by Care for Caregivers, which is an initiative that's a collaboration between SafeCare BC, CMHA BC, and from funding from the Ministry of Mental Health and Addictions. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the land which we each call home. I want to start by recognizing that we are gathered on the ancestral and unceded territories of the First Nations, Inuit, and Métis people across British Columbia. We thank them for being good caretakers of the land and allowing us to be visitors on this shared territory to do good work. I'll just briefly introduce our facilitator for today. So our facilitator is Rebecca Higgins. She's a mental health educator with more than 10 years of experience designing and facilitating mental health workshops and resources, with more than 18 years of experience as a professional in social and community services. I won't take up too much more of her time, and I'll turn it over to Rebecca now.
Thank you so much. And thank you all of us for joining us today for this session. Just give me a moment to share my screen here. Okay, perfect. Thank you so much, everyone. Let me just make this small so I can see what I'm doing. Welcome and thank you for joining us for de-escalation strategies for healthcare workers. De-escalation is one of my favorite things to talk about. It is something that has always been pressing for people like you that work in the healthcare field, but it also has been something that has de-escalation skills have become all the more important for us to have anybody who interacts with the public, really, but particularly people like you who are dealing with people when they're vulnerable. And so that's sometimes certainly what I've done in my past work as well, is working with people when they're vulnerable. And sometimes we don't necessarily see people when they're at their best, and that can impact their behavior. And so we'll talk a little bit more about what that means and the skills I recommend as we go. So just a little bit to let you know what my perspective is, where I'm coming from. So I talk about and advocate verbal communication and de-escalation skills only. I don't do anything in terms of restraints or any kind of physical interaction. That's beyond the scope of what I do and what I can talk about. So I just really focus on what are some verbal communication and de-escalation skills that might help to diffuse the situation or might prevent it from getting more escalated. One of the principles I come from is to not approach if safety is a concern and you're not trained appropriately. And if there's an option, I do understand. I was giving another de-escalation training just this morning, and sometimes it's not possible to leave the space, let's say, or you've called for help and you have to wait for the help to come. So, but you can still keep your space from the person who's upset. And sometimes attending to that proximity, making sure that the person has enough space, more personal space than they would need ordinarily, this can be a helpful de-escalation skill in itself. The other place I come from is to call for backup when you need to. Now, backup looks different for different people in different organizations. And, you know, as we know, many people have had a history of traumatic experience experiences within themselves and sometimes within their community, sometimes going back generations in terms of how they've been treated in various systems, such as the justice system, the healthcare system, the child welfare system, and so on. So, you know, it's sometimes not a complicated thing. That's a lot of negatives. Sometimes it can be tricky to know when do I call for backup. And I invite you to have conversations with your teams to figure out, what does backup mean? Is backup security? Is backup the manager, the nurse manager? Is backup, you know, a coworker to come and help me with this? And in some cases, is backup the police, right? So having conversations about what backup means in your particular setting, what works for you. One of the other points I like to emphasize is that mental distress doesn't make bad behavior okay. And this is related to the next one. Bad behavior is often not mental health related. So this is a de-escalation workshop, but it's not necessarily a mental health workshop, because people get loud and upset and even aggressive for many reasons, sometimes nothing to do with a mental health concern or a mental health challenge. And also many people experience mental distress and don't require you to use your de-escalation skills. So I just want to make sure we resist the urge to equate these two experiences when they don't necessarily go hand in hand. I also believe in the right to feelings versus the expression of feelings. So I believe that a person has a right to be angry. They have a right to be angry at me, but they don't have a right to throw a chair at me, for example. So it doesn't mean that any behavior associated with a feeling is okay, but sometimes we get bogged down in the wrapping paper. We get bogged down trying to squelch the feelings, telling the person, don't be upset. And in fact, that doesn't actually help. And we'll talk a little bit more about why as we go. The other place I try to come from is respect as the underpinning of all interactions. I appreciate that not every person you encounter, not every patient or family member or client or individual is necessarily going to be treating you with respect. And that's why it can be a tricky ask sometimes. But in my experience, when you can come from that baseline foundation of respect or come back to a place of respect, it can sometimes go a long way to shifting the dynamic of the conversation. That's not necessarily what the other person is expecting from you. That may not have been how they've been treated in the past. It doesn't necessarily mean that it's necessarily going to lead the conversation to an outcome that you are looking for. But there's only so much you can control. You can control your piece of the web, your part of the web. And in fact, if you're able to stay calm yourself and come from a place of respect, then you don't have double the work. Because the thing is, you can't actually de-escalate another person. What you can do, I believe, is stay calm, and in so doing, and use some of the other skills we're talking about today. In so doing, give the other person the opportunity to de-escalate themselves. And we'll talk a little bit more about that as we go. So I'm going to ask you to do this just on your own. If we have time, we'll get to this at the end. I'm just going to give you a moment to write down for yourself, offline, not in the Q&A. Just write this down for yourself. An example of a challenging scenario where de-escalation skills might be useful. And we'll try to discuss a few of these examples later in the workshop. So one example could be your patient's daughter is upset, angry. She says to you, you would never treat your own parent like this. Do you pick and choose who to ignore in the morning? How might you approach this situation? And so this example comes from the Provincial Violence Prevention Curriculum training participants. And so I appreciate their contribution here. So I'll just give you a moment to jot down for yourself a sentence or two, a phrase or two about a challenging scenario where de-escalation skills might have been useful or could potentially be useful. Just about 30 seconds more. and then we'll continue on. Okay, beautiful. So if you can hold on to those examples, and we will get to those a little bit later. I want to talk to you for a moment about the framework I'm using today. So you won't have heard of this framework before unless you've taken a workshop with me, because I invented the framework many years ago, but I didn't invent the skills. These are things that many of you are already using. These are skills that I used when I was in the field in social work, and in other settings I've been involved working with as well, including teaching. So I use this framework to talk about supportive communication and de-escalation skills. And we're going to go through each of these to talk a little bit about what this means, how you might concretize this in your workplace. So SAL stands for choices, empathy, listening, limits, and stay calm. So the first skill I'm going to speak to is supporting choices. So whenever possible, support people to make their own choices. And you may be working with people who may have had their choices taken away by individuals and systems. They may be in a health situation where they don't have a lot of choice. There may be, they may feel quite out of control in this troubling moment. So whatever we can do to support an individual's autonomy, that can be not only an important relationship skill, but certainly a very important communication and de-escalation skill as well. So we'll go to the Q&A, and I'll just see if anybody has any suggestions of how you can do this in your role. So just feel free to pop your responses right there in the Q&A. Give options, I see, great. What else? Concretely, what does this actually mean for your work? How can you support people to make their own choices? Good, by listening to them and not enforcing rules. Good. And we'll talk about listening in a moment. Ask them, yes. Absolutely. Most important to establish rapport. Good. Look for opportunities to ask what they prefer when possible. Yes, beautiful. Don't judge their viewpoint. Good. These are wonderful. Great. Informed consent. Yes, absolutely. Good, really good. Okay, thank you. You can keep them coming if you like. I'll give you a couple of examples here in terms, and you can certainly tailor this to your role, to your work, what works for you. Some things that I have found helpful and I have observed to be helpful for other people. Sometimes it comes down to just basic things like, how can I help? Is there someone I can call for you? I have used this one when approaching strangers that are very upset in public. I think this can be, I'll do a quick assessment and make sure, it's safe and appropriate to approach, make sure, I have the wherewithal to do it. But I think this can be a very beautiful way to reach out to someone and to basically say, I can see that you're upset. And it also supports their autonomy, because very often a person might say, actually, yeah, call my sister, or can you call my PSW, or, can you call my GP, whatever it is. My worker. It can be a helpful way to do something concrete to support the person in a way that shores up their autonomy rather than takes it away. Now, this may not always be possible, but one that I found helpful is to say something like, would you like me to see if there's someone else you can speak to? Now, this isn't always possible, of course, and I appreciate that. But sometimes it certainly doesn't mean that you're doing anything wrong in terms of de-escalation skills. Maybe it's just helpful for the person to start over with someone fresh, or maybe you're really exhausted today, or maybe they want a second opinion. Again, this can be an important way to support a person's autonomy. The last tip, I took a motivational interviewing training many years ago, a couple times, And I'm sure that some of you would have taken this as well. And what I love, motivational interviewing looks at the stages of change and how to support people as they move through the stages of change and making decisions about making different choices in their lives and what that looks like from a support role. And so one of the things that stayed with me from learning about motivational interviewing is the idea of asking the person if they would like information about something, a resource, or next steps, instead of just telling them, asking them that. Because the other thing is that many patients and families may already have done some research. They may have already contacted some other providers, some other agencies. And so this really saves both you and the other person from repeating themselves. This way you can make sure that you're offering them supports that are useful for them. Yeah, I'm just taking a quick look at the chat. Consider the lens in which you see the person. Do you see the patient as a problem, or is the patient's behavior an indication of a need for emotional support? Beautiful. Yes, thank you. So behavior is information, and we're going to talk a little bit about what's under what looks like aggression. We'll talk about what's going on underneath that. How about how are you doing? Okay. Again, really beautiful, really just honoring the fact that you can see that the person is upset. And that matters, instead of just pretending they're not, right? So in terms of choices, whenever possible, give people options. You can respect a person's right to make their own decisions, even when you don't agree with those decisions. And that can be a hard one sometimes. And some of you may not have a problem with this professionally, but it's in your personal life where you get your mitts in other people's business. Now, maybe you don't have that problem. I certainly do. I'm okay with letting people professionally find their own path, do their own thing in any of my work roles. But when it comes down to, my siblings, I've got my mitts in it, trying to get them to do things that I think they should do. Not as much as I used to, but certainly a person has a right to make their own decisions. You don't have to agree with it, but they have a right to make those decisions. And it doesn't mean that your viewing of the situation is correct. It's just different. And as somebody mentioned, informed consent is really important. People have a right to make informed choices. So to the best of your knowledge, you can let them know, if they want to hear it, what the options are, and what, you can see as what that will mean for them in terms of if they choose that. Again, recognizing that your perspective is limited. It's only one piece of the puzzle. Even if you're an expert in a given area, you don't know exactly what it might be like for the individual. So remembering that people do have a right to make informed choices. The next skill I want to speak to is empathy. And as came up in the chat already, empathy is woven throughout. All of these skills are woven together in the CELS framework. It's not that that you go, okay, now I will now offer the person a choice. Now I will use empathy. No, of course not. And because of your role, because of the kind of work that you do, much of this you may already be doing naturally. And I find one of the things that's helpful in de-escalation workshops is to point out and reaffirm what people are already doing. So just as to go over this briefly, empathy is using your imagination to think about and to feel into what you might feel like in the person's situation. And something that can be hard to remember, but certainly important to remember, is that often anger is a protective skin over more vulnerable feelings. What's underneath? A dear friend of mine just adopted a dog who is a beautiful, gentle soul. But when she gets scared, she looks like she's going to attack. She doesn't, but she gets in, fight or flight mode. And that's because she's scared. And so that happens with humans as well all the time. And so recognizing that you're seeing anger, and I'm not saying the anger isn't real, of course it is, but also there's something more vulnerable underneath, fear or sadness, a vulnerability. And remembering that when somebody is lashing out at you, it can be difficult to see past that and remember there are those feelings underneath. But even if you can't do it in the moment, I have found over the years, this is a helpful tool for me putting it down afterwards and not taking it on so much when I'm able to recognize, even if I can't in the moment, okay, this person has a lot going on. This isn't about me. It must be really difficult to be in their situation. If you're interested in reading more about empathy, there's many great works out there. This is my very favorite. There is no good card for this. What to say and do when life is scary, awful, and unfair to people you love. And we will, if you are interested in, finding out any more from me in terms of reading recommendations or anything like that, certainly just contact the organizers and they can connect you with me. And I'll leave you my email at the end of this session as well. Crow and McDowell remind us that, quote, we consider compassion to be the heart's natural instinctive response to the pain of others. Empathy is when you use your imagination to expand your ability to feel compassion for people in situations beyond those you have experienced, maybe even in situations completely different from those you have known. I like to try to remember that empathy and validation are connected. Now, validation is not the same as agreement. Validation is essentially, I see you, I hear you, I can appreciate that you're upset. It makes sense to me that you're upset. You don't use that language necessarily, but that's what it is at its essence. A person has a right to their feelings and they have a right to their understanding of their experience, and arguing about their feelings or arguing about their understanding of their experience doesn't go anywhere in terms of de-escalation. It doesn't go anywhere in terms of building rapport. Validation lets the person know that they have been seen and heard. And I've seen this again and again, both as the upset person and as the calm person in many different situations, where when I was the calm person in a given moment and I used validation, I recognize, like, of course this is difficult. If I were in your situation, I'd be really upset as well. Or, I'm so sorry you're going through this. This must be really hard. Or, you've got a lot on your plate. Whatever is genuine, right? I invite you to use these skills from a genuine place. And sometimes it's not about using words at all. A person can feel if you are empathizing, if you are connecting, if you're doing your best to try to understand. And so the flip side of that is, as the upset person, I have, both got more angry when the other person didn't validate me and my experience, and less angry. And sometimes I'll kind of zoom out in the moment and recognize what's happening. And so once I was on with a doctor, I was advocating for a family member, and I was quite angry by the time I got a hold of this doctor. And I have to say he really did an incredible job of de-escalating me by listening, by validating my experience, by shutting up and letting me talk, and by empathizing with my experience. And at the end of it, I said, and I had been very angry by the time I got him on the phone, and I really de-escalated throughout the conversation. And that had been a few weeks of building anger, and it was really incredible the way it was kind of neutralized. Now, doesn't always happen like that, of course. And de-escalation is more of an art than a science. Sometimes things work, sometimes they don't. But I did say to that doctor at the end of the conversation, listen, I got to tell you, I teach de-escalation skills for a living, and that was really well handled. She must have wondered who we'd gotten on the phone with. So in terms of empathy, again, sometimes it's about just how you are with the person, demonstrating you're listening. The expression on your face indicates that you're caring, that you're empathetic, and that you want to understand. But some statements that sometimes have been the vehicle for empathy, things like, this is a really difficult time. I can't imagine how hard this has been. Sounds like you've had a lot to deal with. I'm sorry you're going through this. Nothing complicated, nothing, that you need special skills for, just about the human connection of recognizing this is hard. So next we'll go to listening. I love this quote from Rachel Naomi Remen. Our listening creates a sanctuary for the homeless parts within another person. Sometimes we'll walk away from a conversation thinking, I didn't do anything. All I did was listen. Nope, I didn't give them any solutions. I didn't have any new treatment options. All I did was listen. That is huge. If you were able to listen, that's beautiful. And that's, much more than sometimes than people have experienced before in other areas and other aspects of life. So what does listening mean? So I'm not going to give you just a blurb on active listening. I just want to highlight a couple of bits of things that can be helpful. As much as you can, try to focus. Be patient as much as you can. Be patient with your patients, even though that is sometimes difficult. And the family members as well, of course. Pay attention to the person. So look at, tune into them, attend to what they're saying and what they're not saying. So the words are important, but the tone, their body language, their facial expression, all of this is very important. And try not to jump to solutions, listen first. This is an occupational hazard for many professions. Certainly I had to unlearn the fixing tendency, the writing reflex, as they call it in motivational interviewing. The idea that, okay, I have to fix this, and oftentimes we do that. Certainly I have been, while I was listening or while I thought I was listening, coming up with solutions, next steps, and so on. And listening, you can't get to the solutions piece. Sometimes you can't get there at all. Maybe there isn't a solution to be had, or if there is one, it's one that the person will find. It's not on you to find that. But listening, there's no substitute for listening. So now, of course, this is easier said than done. Listening, there's lots of reasons why sometimes listening is not within the scope of what we can do. So I will invite you to pop in the Q&A. What are some things that make listening difficult? What are some barriers to listening? Just a comment, tone of voice is key. Don't be condescending or patronizing. Absolutely, absolutely. When people are upset, I believe that we are even more tuned in to what's going on in a person's tone, whether they're judging us, whether they're being patronizing or not. And so really watching your tone is important. I appreciate that reminder that came up again in a different de-escalation workshop this morning, talking about just how important tone is. Because it really, I've given you some suggestions around content, but tone is what matters. And your approach, your body language, your posture, whether the person can feel your kindness, and so on. So barriers to listening, what else? Let's see. Distractions, yes, absolutely. Background noise, yeah, that's a hard one for me. The desire to help, solutions focused, absolutely. So I appreciate that, because it's a good reminder that intention and outcome are not the same thing. So we might be trying to help, but we might, if we're skipping the listening piece and we're too solutions focused, we're not going to be able to help. Yeah, which is not always what's needed. Great. Trying to respond with our own experience. Yes, that is a mistake I have made in the past. And certainly sometimes, I was saying the other day that sometimes we mistake projection for empathy. Oh, this is about me and this is what I would do. No, it's not about us in this moment. Even if we have had a similar experience, it's not the same. Everybody's experience is different. Yeah, our relationship with the person absolutely can make listening difficult. Any other things you want to share about what makes listening difficult? I usually try to think of it, most things I've thought of and I've heard other people share fall into 3 categories: our stuff, their stuff, and logistics. So maybe if the person is yelling at us or they're very angry with us, it might be difficult to listen. If we have our own stuff going on, we're exhausted, or we're too solutions focused, or we don't have appropriate supports, or we're at our wits' end. All of these things, that can be our stuff, that can make listening difficult. And logistics. Is it loud? Is there other activity going on? Do we have multiple competing sort of obligations in a given moment? Good. Sometimes people think they don't have time to listen, but if you don't, it can cost more time. Thank you for that. Yes, I heard another trainer say years ago, it's a false economy if you rush now. So even I would rather, frankly, a person say to me, I love to listen, but I'm not able to. I'll come back, after I finish this paperwork or after I see this other patient. Or sometimes just honoring, I'd love to be able to chat more. Unfortunately, I have to go. Sometimes in de-escalation, in any human interaction, you leave the interaction or the other person leaves and somebody's disappointed or both parties are disappointed. That's okay. That happens all the time. It doesn't mean you haven't handled yourself calmly and with integrity. Yeah, lack of time. Predetermined idea of the actual situation. Judging despite myself, personal triggers. Beautiful. Did we say our own judgments about the person? Good. Yes. Language. Yes. Good. So it could be if you and the other person don't speak the same language. It could be if the upset person is using more aggressive or abusive language as well. That can make it difficult to listen. Great observations, everybody. Your personal context at the time. Yeah, beautiful. Thank you so much, everyone. Great content here. The next tip I'm going to talk about is limits. So, I mean, you've heard about this, you've done it, and you may, in fact, I'm sure that you realize the complexity of boundary setting. Boundaries are essentially making it clear what's okay for you and what's not okay for you, but that makes it sound simple, and it's not simple at all. Boundary setting is influenced by a number of factors, including context, culture, relationship, family upbringing, power dynamics, systems, and so on. So I'm only just briefly touching on boundaries and limits today. One way to look at it is boundaries is saying this is okay for me and this is not okay for me. Boundaries is about my stuff, and limits is making requests of the other person's behavior. Unfortunately, I say unfortunately, you can't control other people's behavior. I wish I could. Many times I have wished I could control somebody else's behavior. I can't, but I can make requests of their behavior, of them to change their behavior, and I can make decisions about what I'm going to do in response to that. So a couple of things to remember, and this comes from Kevin Fautrieu's work, Diffusing Angry People, Practical Tools for Handling Bullying, Threats, and Violence. Address aggressive behavior without making the person feel humiliated or vulnerable. You never want to do anything that shames the other person or makes them feel small or makes them feel more vulnerable. You know, I have seen this before, and you know, that what we're doing then is just two people reacting to the reaction. You can recognize that there's something vulnerable underneath. We don't want to do anything that exacerbates that vulnerability, makes that person feel more scared. You can say something like, it makes sense that you're angry, but I need you to stop yelling at me. So here you are validating, you're acknowledging what's happening, you're not ignoring it, but you're also being clear about what your limits are. You could also say something like, I realize this is important to you and I'm doing all I can to help, but I need you to stop shouting so I can do it, or whatever. Now, in any given situation, there are, you know, sort of collective in any given unit or space or organization, there are, you know, sort of some shared collective norms about what's okay and what's not okay, but also you as an individual need to protect yourself, and you as an individual will make decisions in the moment about what's okay for you and what's not okay for you. So I see Claire's question. I'll get to that in just a moment. So because I am only able to touch briefly on boundaries and limits, I really invite you, if you're interested, to look at these books. These are my favorites. I've done a lot of reading around boundaries and de-escalation, and these are some of my favorites. The newest in the middle is Set Boundaries, Find Peace, A Guide to Reclaiming Yourself by Nedra Glover-Tawwab. She has some really wonderful concrete strategies for setting boundaries in a variety of settings. And she has stuff online on Instagram as well, as if you're not interested in the book, but I highly recommend the book. Empowered Boundaries on the left there, Speaking Truth, Setting Boundaries and Inspiring Social Change by Christian Storm. What was revelatory about that book for me was she really pointed out that, you know, you can only do so much about boundary setting. You can't control how the other person is going to respond to the boundary. She says, actually, you can set a completely kick-ass boundary. It doesn't mean that the other person is going to respect it. So she talks about the different skills and strategies that we employ all the time, and how looking back on a moment where there was a boundary violation, instead of only focusing on, oh, I should have done this, I should have done that. We don't want to should all over ourselves. In fact, looking back on that moment, we can learn, we can ask ourselves instead, Storm says, what did I do to survive? And so we do navigate boundary violations, big and small, in lots of adept and creative and flexible ways in the moment. So pulling out what we did that worked for us and how we protected ourselves can be really important in terms of boundary learning. The last piece is the one I mentioned earlier, Diffusing Angry People. some helpful kind of concrete stuff there around if you're dealing with people who are getting violent, for example. There's also stuff around verbal de-escalation skills in there too. I'm just going to go to the chat really quick. How do you interject someone on a constant loud ramble, especially with dementia? Yeah, very difficult to interrupt their conversation, redirect, and diffuse. Good. So there's no one way with de-escalation. It's you know, there's no template that works in every moment. There's different things that I've tried. Sometimes I'll name what I'm doing. Depending on the person, I might say, is it okay if I interrupt you? Or, you know, can I just interrupt you for a second? Or, sorry, I need to interrupt, right? And it depends a little bit on your relationship as well. I worked with someone once who we had an agreement that when I would put up my finger, this meant I had something to say in response, right? So of course, that one may not be relevant in terms of working with someone with dementia, but recognizing there are moments where you may need to interrupt, but you're not reaching for that as the first thing to do, because which of course is not what you're suggesting. But so those are some tips that I would try. Setting boundaries may not be the best if the person is upset, their executive functioning is offline. That may be true, but you are also entitled to set boundaries. You may choose different ways for how you do it, right? Sometimes it's taking a step back, an actual step back. It's not necessarily verbal boundary setting, but you know, it might be having somebody else take over. It might be giving the person a minute, taking a break and coming back. So recognizing there's different ways to set boundaries for sure. But recognizing that you can set your part, that doesn't mean, again, that the other person will respect your boundaries. We hope they do, but they don't always. You're responsible for the setting boundaries part. You're not responsible for how it's responded to. In terms of staying calm, this is easier said than done. What makes staying calm challenging? I invite you to pop in the Q&A. What makes staying calm challenging when somebody is upset? Your own emotions and concerns. Yeah, absolutely. Someone yelling at you, for sure. Some people are quite able to go with the flow if someone's yelling at them. I'm not, for example. Number one, my own triggers. Good. Personal attacks. Yes. When you feel threatened. Absolutely. All of these. Don't take it personally. Yeah, it can be hard not to take it personally. And when we do that, that contributes to us not staying less calm. Absolutely. The fact that you may be having other stressors. Absolutely. If you're exhausted, if you don't have appropriate support, if you've been asked to do more with less, if you have stuff going on outside of work as well, of course, very understandable. Trying to support others at the same time. Good. All of these, great. Okay, we'll move along just in the interest of time, but do feel free to keep popping things in the chat and I'll get to what I can into the Q&A rather, sorry. So in terms of staying calm, what I have found over the years is that modeling calm is much more effective than preaching calm. Think of times that people have said to you, calm down, and how that felt, and times that you've tried to say that to other people and whether that worked or not. Modeling calm, trying to stay calm yourself is not only better for you in terms of navigating through the situation, it's better for the other person as well because it gives them the opportunity to calm down. They won't necessarily do it, but if they're amped up, and then you're not able to stay calm, so you get amped up, then there's double the work, right? Then there's no place for them to go. Both of you are reacting to the reaction. And sometimes that will happen. Sometimes we're not able to stay calm. And that's where I think self-awareness is so important, because recognizing, oh, you know what? I can't calm down. I need to take a break. I need to let so-and-so take over. I need to put this person on hold if they're on the phone. I need to breathe. I need to find my feet, whatever it is, to be able to navigate through that as best as possible. So here are some tips that people have found helpful, myself included, in terms of trying to stay calm in the moment. I mentioned find your feet, which is a grounding tip, a mindfulness trick that is exactly what it says. If you don't have access to that, you can also do find your seat, just paying attention to your body for a moment, whether it's in the chair or your feet on the ground. can be something that's useful in terms of helping you to stay calm. If anybody else has any other suggestions, things that have helped them to stay calm in the moment, it might be helpful to say, you know, as it says on the screen, you know, this isn't about me. It's not personal. You can tell yourself to slow down. You can tell yourself to breathe deeply, consciously take a breath or two. And again, recognizing that there are lots of really good reasons sometimes why you might not be able to stay calm. It's not a personal failing. It's an understandable response. And so sometimes if we're not able to get back to a place of calm, as I said, sometimes we can rein it in and we can come back to a place of calm and continue on. But sometimes if we're not able to calm down, it's time to, again, interrupt the conversation or end it or let somebody else take over or tap out. Any other tips? Please go ahead and share them at your leisure. Couple of things about self-awareness. Self-awareness is really crucial when we're talking about de-escalation, because as I said, we only have control over our little part of the web. And so, you know, we can't actually do anything about the other person's behavior. We can support them. We can take care of ourselves. We can stay calm. We can't actually control somebody else's behavior. So try to pay attention to your own reactions, recognizing that you can't control someone else's behavior, as I said, but you can control your own. There may be moments where you can't return to a place of calm, and this is when it's time to stop or at least pause. Try not to let your ego and pride take over. This can be very difficult if someone is trying very hard to make it personal because they're upset, because they are dealing with their unmet needs, and they're trying to, you know, communicate with you and get what they need. And so sometimes, you know, people will intentionally or unintentionally poke at your ego, poke at your soft underbelly to try to get what they need. So try not to take it personally. Try to remember this person is in struggle in this moment. This person is scared or in pain, and it's not about you, even if the person might be trying to make it about you. Okay, so I'm going to go over some de-escalation tips here, and then we will look at some of your examples that I asked you to jot down for yourself earlier. My top 10 tips for de-escalation, and these are not just mine. I'm sure you've seen them or some version of them in other trainings and probably use them on an everyday basis yourself. The first is respect personal space. So don't touch the person. We know this now in terms of trauma-informed approaches and training that, you know, people have different experiences with touch. So as much as possible, when a person is upset, unless you are completely convinced about how they're going to receive the touch, or unless they initiate it with you and it's appropriate, you know, respect that personal space. Recognize that when a person is upset, sometimes they need actually more space than usual. You're not going to stand in the hallway and shout at them, but making sure they have enough space that they don't feel hemmed in. Take your time and be patient. As people mentioned earlier, this is so important. And it's also very difficult when you are pressed for time, when you have deadlines, when you have management breathing down your neck, when you have all of these pressures systemically and personally and across the board. Do your best to take your time and be patient, recognizing the limits of that as well. It's not necessarily your personal limits. It might be limits that are created by the systems you have to work in and the system failures, right? So recognize what you can do and what's not yours. Attend to body language and tone of voice. This is very important, both the other person's and yours. I'm a very chatty person, especially in this kind of a setup, but in a workshop setup, I'm very chatty, but the reality is the content doesn't matter that much when a person is upset. What they are telling you with their body language and their tone of voice is more important than what the content is. I'm not saying ignore the content, but hold that as only one piece of the puzzle. As well, recognize what you're communicating in terms of your body language and tone of voice. As someone pointed out wisely earlier, you want to really watch your tone and make sure you are not being condescending. People will pick up on that. Even I believe that when we are distressed, when we're in pain, we're even more tuned in to what is judgmental or dismissive or condescending from someone else. Tip number 4 is empathize and validate. I believe that empathy and validation, as I said, go hand in hand. That doesn't mean pretending to share the person's experience. It doesn't mean that any behavior goes or they have a right to treat you however they want, but it's about recognizing that, yeah, this is hard and it makes sense. And perhaps if I was in this person's situation, I'd feel this way too. And I haven't been in this person's situation, but I've had another dark time. And in that moment, I felt really angry as well. Right? You're not narrating that. You're experiencing that sometimes very quickly in the moment, connecting with that sort of human condition of pain that the other person is feeling in this moment. And empathizing and validation is so important when we talk about de-escalation. Tip number 5 is be non-judgmental. We talked about that connected to body language and tone of voice. I think it is impossible to just be non-judgmental all the time. That would be beautiful if we could do that. I don't think that's realistic. What I do think is realistic is to recognize when judgment is creeping in and when to put that on the shelf. Look at it later. Right now, just put it aside as you're approaching and dealing with the person on a human level. Don't engage in a power struggle. This is true. No, it isn't. I'm the boss. I'm the one who makes the rules here. You don't want to do anything like that, right? Then that just makes a person feel more vulnerable, more amped up, more leaning towards escalation to try to get their needs met. Try to connect with the emotion that's under the behavior. And I mentioned this earlier, really recognizing that under what looks like anger and is anger, people are more than one thing, and people often experience more than one thing at the same time emotionally. So sometimes a person is showing you anger and underneath they are afraid. Underneath they are sad. Underneath they're vulnerable. They've been disappointed and let down, and all the other sort of sub feelings that go that kind of come out of fear and sadness. So I'm not suggesting you name that. Certainly I would not love it if I'm angry and somebody says, yeah, you're yelling, but I know that underneath that you're scared. That's just going to make me yell louder in that moment. So it's not about naming it, but it's about recognizing that a person is probably afraid or sad underneath. In fact, I think I've never encountered a situation where there wasn't some fear or sadness underneath that anger as well, because anger comes out as a way to protect us and ourselves and our loved ones. Let me just quickly go to the chat, see if I missed anything. Oh, beautiful. Offering the person a glass of water or a drink, I find completely diffuses the situation. Yeah, that's a great, I'm not sure if that was for this tip or for the last slide about how to stay calm, but it's absolutely a great tool, really great tool, something concrete for the person to focus on. It gives you an opportunity to breathe and pause, and them the opportunity to do the same. And it's also a gesture of caring, which people can really, sometimes people also just really need to drink water. They're really thirsty. But even if they're not, that gesture I think is really beautiful. The next one is agree to disagree. So sometimes I was in a situation a couple of weeks ago where I was giving a workshop and in person, and somebody was really disagreeing with something I was saying. And it gave me the opportunity to practice the skills right in the workshop. And, we couldn't get to an agreement point, and we didn't need to. It was a difference of opinion, and that's completely okay. But I said, I don't agree with you, but my experience is different, and I appreciate you sharing that. And so it sort of took the wind out of his sails a little bit. There was nowhere to go after that, because I had heard him. I didn't agree, but he had the opportunity to say it, and I said my piece, and then it was time to move on. So agreeing to disagree sometimes can diffuse the situation as well. Let people vent. Now, letting people vent is like letting the air out of the balloon. Sometimes we're very afraid of feelings, and we don't want to the person to be upset, and we want to kind of squelch that and make them okay. It can be very healing, very supportive, and go a long way towards de-escalation if we give the person the opportunity to vent. I was once de-escalating a situation on the subway, and really that was the key thing I was doing, was letting the person vent, letting them get out what was difficult. Now, sometimes this requires you to be tuned into what's happening with the person. You can tell whether it's venting or whether it's ranting. And for me, the difference is Venting is, you can see it's like letting the air out of the balloon. The person is coming to a calmer place. It's not always that linear. They might go up and down, but you have a sense that they are getting a little bit more calm, that they're, by venting out, they're able to get off their chest a little bit what's difficult. Now, ranting is when things are getting louder, the person is more inflamed, talking about it is getting them more upset, right? And so, you know, that can be a delicate balance. You don't want to interrupt, but you also you want to be able to support them and want to be able to navigate through it as smoothly as possible. So recognizing the difference between venting and ranting is often just an instinctive thing, but you know, sometimes if a person is ranting, you might need to interrupt carefully and respectfully, or you might need to say, okay, let's get back to how I can help you, or let's focus on what your next steps are, or how, you know, what I can do for you, something like that. And the last one is know your limits. So, you know, you are not, all of you, especially people on this call, you have incredibly difficult jobs. You are dealing with people when they are often, as I said at the beginning, at their worst, and they might be at the worst experiences of their lives. They might be very afraid. They might be in a lot of pain. You know, they might be grieving. They might be all of these things. And you might be those things too. So recognizing what your own limits are, recognizing, you know, as much as I would kind of love everybody to be walking around wholeheartedly, deeply listening to people all day long, that's not actually practical or useful. You'd be so exhausted by the end. So I think part of knowing your limits is recognizing when you've done what you can do, and it, you know, you need to step back in a given interaction. Part of knowing your limits is giving yourself grace, forgiving yourself if you weren't as calm as you would like. Take what you can from that in terms of learning, but, you know, don't get bogged down in it. Knowing your limits in terms of your expertise as well. Is there another area? Is there somebody else that can come in to help with what the person is asking for? And knowing your limits is also about recognizing what's yours and what isn't. You know, sometimes you get blamed for system failures. In fact, that may happen a lot. And that, you know, that isn't fair that you're the ones left holding that. So I think knowing your limits is about recognizing, you know, what you need to be accountable for and what isn't yours. Okay, I think now what we'll do is we'll go to the scenario discussion. And I'll also open it up for questions now. So if anybody wants to share in the Q&A, either a scenario you'd like to discuss, or a question, or a strategy you'd like to share with the group. Now's the time for the Q, and I'll try and do the A. I'll leave it for a moment, and if nothing comes up, we'll go to the example on the screen and see what you think about that one. Our hospital is a publicly owned district. We cannot put no weapon signs on the door, but can ask them to take them out. Any suggestions? That's tricky. I don't usually have to deal with the weapon situation, I have to say. That's not something I've encountered myself. Are you asking in terms of suggestions for how to ask them to take them out? You can just clarify that a little bit. If you can't put a sign, you know, you could, and again, this is not my area of expertise for this one, but I would, you know, one thing you could do is have a place, you know, in the room or some place where they could put the weapons, for example, without any judgment and without you know, attention being drawn. I don't really know how that would work, to be honest. It really just depends on the space, but maybe you can just clarify what Let me scroll up. Yeah, some polite language. Okay, so as much as possible, you know, you could say something like anything sharp or anything that could hurt me or you. You know, if you don't want to actually say the word weapons, because sometimes people don't really intend it as a weapon, right? Or it's not the reverse is that it's, you know, it's something that is like, let's say a person has, you know, a Swiss Army knife that they carry there because it helps them to feel safe, right? So that's, you know, you can use language like keep it concrete. If you have anything sharp in your pockets, you know, I'll ask you, or anything that can hurt me or you, I'll ask you to put it in this box here, something like that, and let them know what's going to happen, right? If you're not confiscating it, if you're going to return it after, which I assume is what's happening here, let them know, you know, when you're ready to leave, we'll get this back to you. So concrete, polite, not judging, you know, just something that lets them know if you could put it over here, and leading it back to so I can better help you today. So that's what I would suggest. I don't know if that helps. Let me know. I would say, I understand why you're upset. Let me give you some options on how to move forward. You're suggesting that for the example on the screen, I think. So, okay, good. So I can, I think that's a great idea. The only thing is that in my experience, and I only say this because I've made this mistake. Sometimes when I've said, I understand, if I haven't had the same experience, or if the person is, you know, even if I have, a person might say, you have no idea what I'm going through. You don't understand where I'm coming from at all. And there is a space to recover from that. You can certainly say, you know what, I think I made a misstep there. Let me take a step back. Why don't you tell me again what's happening for you? And that can be a supportive way. But you can also say, you know, I can see, it makes sense to me why you're upset, or I can appreciate that you're upset. Would you like some options on how to move forward? Good. I have found meeting with a new patient, asking how I can support them during their stay, how I can be a support, has been great with establishing rapport and trust. Yeah, beautiful. That's beautiful. So that's, again, supporting their autonomy. You're giving them choices there. You are establishing rapport. And if there is a relationship there, you are going to have fewer problems with escalation, because there's a softer place for the person to land. So yeah. We always tell them we'll give it back. Okay, good. Unless police are involved. Right. Absolutely. So just, again, you know, if you have something sharp, I don't want to prick myself when I'm helping you. So if you can just put that to the side, we'll make sure we get that back to you when you're ready to leave. So I think, again, the de-escalation skill there is the non-judgmental piece. You're not asking, what's this for? You're not, you know, showing like judgment or distaste or fear on your face. You're just being really concrete and clear about it. And that's going to put the person more at ease. So that's the one piece. And the other de-escalation skill there is forecasting, letting the person know what to expect. You know, at the end of your stay here, you can take that with you again. I am sorry that you feel like your mother is being ignored. Good. Again, tone here is really important. So you want to convey that you've heard the person. You know, sometimes people will say, oh, I'm sorry you feel that way. And it's dismissive. I'm not saying that's what you're suggesting at all, but sometimes people will say that and it can feel dismissive. So you can just say, you know, I'm sorry that it feels like that. How can I help? Or what can we do differently? What would you like to see happen instead? Right? You're not promising anything, because false promises are only going to make a person feel more angry, more isolated, more alone. But validating their upset and working with them to see if there's anything that you might do differently, it requires a bit of humility here as well. It's not worth, if you may know very well that you have been treating this parent very kindly, it's not going to be helpful to get into a situation where you're like, that's not what I've done. You know, I treat her just like I would treat my parent. You know, none of you have suggested that, but it can be tempting to kind of get into those kinds of conversations. And, you know, although that might be the way we go sometimes, if our goal is de-escalation, that's not necessarily the first choice I would recommend. Do other people have questions or strategies or scenarios you'd like to share? Some great engagement so far. Thank you so much for this.
Hi, everyone. I'm just mindful of the time. We have 1 minute left. So if there is, thank you, Rebecca, by this. This was a wonderful webinar, so much information and so helpful. If there are any other questions, comments, this webinar will be recorded and available on the Care for Caregivers website. I'll also be sharing, I can share Rebecca's contact information or any other information that's shared today. If you want anything in specific, please feel free to send me an email. And I will definitely be posting this on the Care for Caregivers webinar. So I encourage you to check out the website, also access our podcast, as well as our Care to Speak line. So thank you everyone for joining us. A big thank you to Rebecca. This was such a wonderful hour with so much great information, and I really appreciate you taking the time to be here with us today. Thank you everyone for joining us, and have a wonderful rest of your day. Thank you so much.